but feel free to jump in with questions as we go along. Happy to make this a conversation. I don't want to take up too much of your agenda. So if I go too fast and you want me to answer specific questions, feel free to just let me know. So we're here to just give a little bit of an introduction about the Social Care Network. It's a new way to support Medicaid clients, and for organizations, there is a reimbursable portion to being a part of the Social Care Network. So we'll briefly go over and touch on what the Social Care Network is. And it really does stem from this NYHER, New York Health Equity Reform. It's, as I mentioned, part of the 1115 waiver amendment. As you can see in this the circle grid, the Social Care Network is just one component of this 1115 waiver. It really does touch on those health-related social needs, how we can improve that health integration across health, behavioral health, and social care. But the other two initiatives within this amendment are just strengthening of the workforce. So there are different organizations, and this one is mostly sponsored by the SEIU, where they're working on funding education and professional placement for services across healthcare and behavioral health, and helping potentially to provide some loan repayment for healthcare professionals moving into more underfilled roles. And then there's the large portion, which is population health. We've heard about this for years, but this is still about and continues to be about improving those health outcomes, advancing health equity, and reducing health disparities. So all together, we are working on how we can improve the overall system of care for this underserved, uninsured population. So we are here today, and the Hudson Valley Care Coalition is the lead entity of the Social Care Network, and we'll dive into a little bit about what that is. So for health-related social needs services, there's housing supports, transportation, case management, and most importantly for you all, the nutritional component. And what this does is there is a 12 screening question that all Medicaid recipients are looking to be asked at this point during this waiver period, which opened up in January of this year and runs through the end of March 2027. So we have just about 18 more months left of this waiver period. The 12 question questionnaire really does touch on at a very high level an individual's needs that might be currently unmet today. So there are a couple questions on nutrition, for example. There's a couple questions on housing supports. Is their house safe for them? Are there potential issues like pest and mold that should need to be remediated? Is it still functional for them from a able to get around if they're up on a 5th floor, but it doesn't have an elevator and they're no longer able to walk those stairs, that house is not safe for them anymore. So there's questions at a very high level that will get to them. The nutrition really does at a high level try to break down what those unmet needs are. Is it more than just a food pantry need? Is it a new diagnosis and they do not quite know how to feed themselves the right food for their diagnosis? Is it that they need some counseling? So all of these nutrition, it's not just about your basic nutritional service, but it starts to get to what an unmet need looks like in 12 questions. Very high level, will usually seem to pop positive that there's an unmet need, which then goes into a more detailed eligibility assessment so that we can really break down, especially in this nutrition field, what might be needed for them and how we might be able to help meet that need and who. So within the Hudson Valley, our goal is to improve the health outcomes and reduce healthcare costs by addressing these social determinants through a coordinated whole person approach. And just to level set everybody, the Hudson Valley for us covers these 7 counties, all the way from Dutchess, Orange, Putnam, Rockland, as well as Sullivan, Ulster, and Westchester. And when we talk about the waiver period being for all Medicaid members to at least be initially screened, That attributes to over 600,000 lives. That fluctuates, as you can imagine, based on who's coming on and off, but it's over 600,000 attributed lives to try to get screened before the end of March 2027. Why we say there's a funding and reimbursement, because it's also needed for organizations if they want to raise their hand and become a part of this, to know that there is a financial stream for them to even just do the screening component. So all of these services are reimbursable for these organizations if they want to be part of the social care network within the Hudson Valley. But this is the ecosystem that we're working on building and have been building through our health home line of business as well as our IPA, but we really focus on having the Medicaid members at the heart of all of this, surrounded by our community-based organizations, primarily, obviously, organizations serving people with different abilities. We are now putting ourselves there as the lead entity of the social care network. And then we get into some of those initial primary care, behavioral health, as well as organizations that are serving the LGBTQA plus population. And then as we break out one more level, that's where we start to see our county governments, our larger healthcare systems, as well as our MCOs and MLTCs, so your insurance-based companies. We're looking to build that ecosystem because it's really fundamentally at this point being led by community-based organizations and county governments supporting on the outside from there. And all of this helps drive that Medicaid member to having services that they need when they need it. Obviously, there's always room to continue to build, and we're looking to continue that ecosystem build. Our current network from a social care network viewpoint is we have contracted with over 130 community-based organizations to help us provide these related services. So these 130 does not mean they're doing one or all 3 or 4 of these services. They can do any mix. It's very flexible. But to provide the screening, the navigating or care management services, or it could be at the other end of the line where they're accepting referrals and actually providing those unmet need services, such as home and pest remediation or nutritional services. Again, running the gamut from food boxes, food pantry, to clinically and medically tailored needs as needed, or even just nutritional counseling, newly diabetic, not understanding what they can and cannot eat, what the caloric take needs to be. Perhaps they screen positive for some nutritional counseling, as well as some medically tailored or clinically appropriate meals. So we have organizations over 130 that are doing 1, 2, and or 3 services. We have some providers who are saying, we'll also help out on the beginning and help out with some screening. So it really does allow itself to be flexible. We're also working with our many hospitals and primary care on integrating these services. They're joining our network and screening in some cases, and maybe even navigating or providing services. Usually if they're providing services, they are providing those nutritional counseling services. Others, such as some primary care, especially behavioral health, they don't necessarily have the workforce to screen, but they want to refer. So they're seeing a lot of these members come in as patients of theirs, and they say, you know what, I have access to them. I want to be able to refer them. How can I do this? How can we make this work for the member? They don't want to just say, hey, there's a social care network out there, you should look it up. So we're partnering with them and collaborating with them to do warm handoffs and helping that next stage, which is usually the community-based organization, have that handoff with that member from those primary care or behavioral health centers where that screening then can be completed, and it's done with trust. We're also working with our local county and local government on our IT platform. So it is a referral-based platform, but it extends far beyond the social care network. So you don't necessarily have to be providing those services to be in this platform. And that's where our county and local governments are. Several of them have already joined our IT platform. Others are in conversations so that if there's other services that they provide, we can do that all electronically, those referrals electronically, so that it stays a little bit seamless and a little bit more efficient. How are we getting our word out there? Well, I'm here to do this with you, and I'm doing this throughout the Hudson Valley with all different member service organizations or county governments, just to educate and raise awareness about the social care network, how it's beneficial to the members that you might see or interact with on a daily basis, but also potentially for you as an organization yourself. The message should be simple, it should be impactful and relatable. And with those visuals, we're creating rack cards, flyers. We're starting to see ourselves on the backs of buses. We have put up a few billboards, and really that's to attract and to start that education to the member directly. Social care network does not in and of itself define what those services are or how they might be beneficial to the member themselves. So we really want to just get the word out there. And we've been trying to spend a lot of equal time between education and awareness as much as we are making those outreach calls directly to members of certain organizations to get that screening done in partnership and in parallel. We're creating those collaboration services. We're partnering. We're looking to attend as many community events or have our community-based organizations attend those events and activities to continue to build relationships across the spectrum with members directly, with other organizations to help raise awareness about these vital resources that are offered and are offered right now only through the end of March 2027. These services are quick, they're efficient, more so than some of the other services that are out there. Like we know we are also a health home. There are certain services that are not covered under the health home that are in fact covered under the social care network. It's a little bit more broad, and it's because of our partnerships of 130 organizations, we're able to get through that process pretty quickly. So understanding the service to actually receiving the service, the time is short, usually within a couple weeks to a month, depending on what it is. So if you can imagine that timeline, nobody truly needs to wait a long amount of time for a service to be understood and then rectified. Impact. We're looking and we have highly successful stories. We're calling them really impact stories, as you'll see on the next slide. We wanted to make sure we shared a couple of how this is really integrating and being lived in the real world. We want to be able to present data and statistics because on the other end of that, we have to understand how is this really impacting the community as a whole, as far as the services being offered and available, and how the members are being able to be serviced, and then how is that driving their next steps. If they have forever gone to a crisis center or an emergency room situation for certain services, if we're able to help them up front of that, is that decreasing those emergency, non-emergency services that they're then utilizing? And the data is showing that it is. It's staving off those emergency room visits. And then we're looking to ultimately showcase that community impact. How are having these members connected to services impacting the community as a whole? Here's one story where a single mother was able to find relief after eviction. So we had a 30-year-old single mother with a child. She was recently evicted. She did not have stable housing, and her child were placed in a temporary shelter with housing costs covered by DSS. While she was employed part-time, she did not have reliable transportation, which made it very difficult to access food and other essentials. So using our IT platform and the social care network, she was able to be screened and her most urgent needs were met. Catholic Charities was our organization that was receiving this screening and help navigating the single mother, and the manager was able to secure that food assistance. It was delivered to her hotel, ensuring that she had and her family had that immediate relief. But the real kicker here is that it took a compassionate approach. These are real people with real stories and sometimes real trust issues. It doesn't just happen with a simple conversation. Let's answer some questions and move on to the next. These are relationships that are being built and formed. And because of this compassionate approach, the mother felt that it was safe for her to be able to share her struggles openly and to really then, in fact, get the care that she and her daughter or her 6-year-old child needed. and it was quick. Catholic Charities was then able to meet her most pressing needs. And with the food and other essentials in place, she now had that little bit of breathing room to focus on rebuilding that stability for herself and her child. Tony was in a little bit different situation. He's in his mid-50s. He connected through the social care network through a different partner, independent living, during just a routine intake call. His screening revealed urgent needs for both housing and food. And within days, he was linked to Hearth Meals, where he began receiving weekly meals delivered to his house. At the same time, Catholic Charities was able to provide rental assistance so he could stay in that house. Together, that stabilized his housing and his immediate need for food. He's now been able to try to refocus on his health and rediscover hobbies and lean on his family. For the first time, he feels hopeful and he feels supported. These are just two of the many impacts that we've seen in just the 10 months that we've been working through the social care network, and how we can help direct this care and get them the care that they need when they need it. So when we sit here and say what you can do, there's so many things that you can do. You can certainly join our Hudson Valley Social Care Network on a contracted basis to be able to screen and navigate your clients potentially. There's that reimbursement stream that helps a little bit. It's not a windfall, but there is certainly some financial reimbursement. You could also just provide referrals, having the understanding of the social care network and being able to offer that as a potential for those members that you come in contact with. If it's just about having flyers or rack cards available in your organization, that's great too. Again, that helps us get the word and the information out. It helps us educate others about that social care network. And how we can get there. We are completely open and flexible. We want to build this ecosystem. We want to partner and collaborate with whatever ways that looks best for you and your organization. We're here, we're open. And I will stop my presentation there and help field any questions that I can, but I do want to say thank you for your time. I know that was quick. I wanted to make sure that I didn't upend your whole agenda today. But I do want to be able to take any questions that there are.
I have a quick question. You
Yeah.
mentioned the technology that people are connecting. Is that the Unite Us platform?
It is.
Okay.
So Unite Us is a referral-based platform. It's been out on a national base for several years. So it's not an EMR like a medical record of a hospital. It's much more easy to use. It's a referral-based platform. It does have our Medicaid demographic information in there to be able to link to. And then on the back end, when we refer services, we're able to do so seamlessly electronically.
And if I may, I just took that training the other day, and I was really excited that that platform has a list of services that you don't even initially even need to be sort of officially doing referrals to use that platform. So
Correct.
I'm kind of excited to make a bookmark here for Eat Well to talk about. Well, for years, we've been talking about what's the best way to show what resources are in the community. So I just want to put a bookmark here for anyone who's interested in talking about that more later, that this might be helpful in that solution, finding a solution.
And like we said, that's where we are building that referral network. It doesn't have to be just for the social care network, just to seamlessly integrate and coordinate services across the Hudson Valley is a great step forward for us.
Are there any other questions? Thank you so much. That was very, very informative. I'll probably rewatch the recording because it was jam-packed.
Absolutely. Let me say, if you have questions as you're going through, oh, Samantha, go ahead. I was going to say, definitely feel free to reach out after this meeting. That's not a problem.
We're sort of a small group. I hope you guys don't mind if I ask a question. So we're on the Unite Us platform. We've been on it about a year, I would say. We jumped on with Sullivan County before Ulster got onboarded, so we've had it for a little bit. And I'm curious, are there lots of people that are officially onboarding on Unite Us? And the reason I asked is just because we're getting no activity on it whatsoever.
One, we can certainly look on the back end on how to make sure that you are linked appropriately. We've had some, I'm not going to say We've had some coordination issues to make sure that people are open to accepting referrals, just not being out there. So one, offline, Samantha, I will look up and have a conversation with you. Services have been growing, I'll put it that way. It was a slow
Okay.
start off to the 11-15. January, February, March, not many people understood, even at the organization level, much less the member level. In January, I think at the end of December, our insurance company sent out a blast, a letter blast though, snail mail, to their members to say, hey, opening in January is this thing called the Social Care Network. You might be able to receive services. So certainly we received some calls in January, but not a lot that understood what it was, especially if you even opened your mail. Not everybody opens actual mail. So January, February, March is when we certainly opened for business. It was slow, very slow. And then as we started to raise these awareness externally ourselves in conjunction with New York State DOH, I'll say this is the last summer, June, July, August, and now even more in September is really when we've started to see this growth period where screenings have finally started to take place. But Samantha, to your point, I will say of the 600,000 that we are attributed to in the Hudson Valley, so far we have only screened to date 2%. A little over 2%. So there's a lot more that needs to happen. And I think we're going to start to see exponential growth as we are starting to really formalize not only the education and the awareness, but how we're getting outreach to members with our partnered organizations and different technology and vendors that we're able to do. So not so much waiting for them to come to us, but actually making those outreach calls. Is another tactic that we've been using. But Samantha, I will certainly take a look offline just to make sure you are set appropriately the way you should be.
Yeah, I'd appreciate it. We received 2 referrals early on for nutrition coaching, funny enough. And then it sort of stopped after that. So I don't, maybe something on the back end got
It definitely could have. I will look back and try to get you answered today.
Thank you. Much
Of
appreciated.
course. Yeah.
And I was just going to share that should this work properly, we tried to put all of our nutrition services into the platform so that we could get referrals for that one-on-one coaching service that we provide. And I know that's going to be a big need sort of moving forward with all the changes that have happened recently. So we want to make sure that that resource is available to those who need it.
Agreed. So yeah, I will certainly get back and look to see how your org is set back up.
Thank you.
No problem. Thank you.
Any other questions or comments, ideas? And then Megan, if you wouldn't mind putting your contact information in the chat, that way if anybody has any follow-up questions, they can reach out. We'll also have it in our meeting notes too.
Absolutely. That helps if I type it. Yes, it will be there.
Great, thank you so much.
Thank you for everybody for allowing me the time to meet with you all and talk with you today.
Yeah, we appreciate it. Thank you. All right, and I am going to also put the agenda back in the chat.